access them. I'm really proud to say that we've been there since the very beginning, 6 years of funding. You know, we're first 5, so we gave prenatal support. This was before you went live. We were there to fund the database and to provide some resources to get the operations ready to launch. I'm also not too proud to say that I don't think we had any idea as to what it would become. We thought it sounded like a great idea, Central Information Referral Service, what can be better than that? But I don't think that we had a clue as to what an invaluable service it would become. In the very early days, there was absolutely no one who had heard of 211. So I'm actually happy that you got 30%, to be honest with you. There was nobody who heard of it. And so I would say to people things like, well, it's like 411 for health and social services, and people would kind of glaze over and nod. When I think about that, what an understatement. 211 is designed to be so much more than that. The research that the operators do, the personal attention that they give, and the follow-up in many cases. With due respect to 411, I'm looking at Mike's watch because I don't know if I'm going to step on anything here. But with due respect, and it's a service I highly regard, but can you imagine calling 411 and not having an address or the correct spelling of a name or a city and saying, I'm just looking for an Italian restaurant, can you help me? Couldn't do it. But you can call 211 and you can say something as vague as, I'm looking for mental health services in the city of Oxnard. And guess what? You'll get a whole listing of services, and you'll get someone that will ask you enough questions to make sure that they're giving you the answers that you need. They'll also ask you, do you have a young child in your house? And they will refer you to local community resources. You'll get more than you ever even knew was available. That's a service that's truly been invaluable to the community. Let me just talk briefly about kind of what happens on the ground and how it's really useful to people. For us, 211 fields about 300 calls a month from families with young children. And most of these calls, as you heard before, are for the most basic of needs. These are families looking for food, shelter, health care. And they help get these families services. One of the things that has also happened that we have no clue what happened is that it's become an amazing resource for our providers. So for community support service staff out in the community, they call 211. They might have a family in front of them, but they use 211 as a resource to be able to help that family navigate the system. And finally, it's been the most amazing marketing tool. For the past 2 years, we've been able to run regional campaigns. This is throughout Southern California with other First 5 commissions. The last one has been about early literacy, reading to your children. And the number we use is 211. Why? Because in 7 of the 8 counties in Southern California, there's a 211. And so as a tool to reach people, to message, to communicate, it has also been invaluable. We've come a long way in these 5 years. People really are using the service. At least 30% do know what it is. Every quarter, Interface does customer satisfaction surveys. And they ask people, so you used 211, was it a good thing? Consistently, over 90% of people say that they got what they needed and that they would refer their friend to a service. Pretty high. This morning I was at a meeting and I mentioned to someone, today's the 5th anniversary of 211 and that's where we'll be tonight. And this person said, wow, thank goodness for 211. Where would we be without it? And for me, that says it all. Thank you very much.